As with version 1, both the hip clamp and the heel clamp locate and secure onto any work surface up to 75mm in depth. The femoral clamp and the heel clamp are positioned relative to each other, allowing the joint line of the knee to be refined for each type of arthroplasty procedure. Both clamp positions are easily changed relative to one another, increasing or decreasing the angle of the femur in relation to the tibia. Locating the heel of the lower leg into the bench clamp has been simplified. Improving stability, the new clamp allows for rotation of the lower leg relative to the distal femur. Made from aluminium, it keeps weight to a minimum. The hip clamp is a ball and socket assembly that locates onto the femoral bench clamp using a 3-point hold to stop rotation. The locking clamp is secured into position using the black thumb wheel and washer until tight. The head of femur is unlocked by sliding the black lever on the top to the forward position. Attached to the femoral head is the new femoral neck. This component is a compound angle of 135 degrees for the femoral neck shaft angle with 15 degrees of antiversion. We can supply this component with any compound angle you require. The anatomical axis is perpendicular to the epicondylar axis of the distal femur insert, whilst the mechanical axis of the femoral shaft is perpendicular to the joint line. They are controlled relationships built into both the MITA trainer and the replaceable inserts. The basic knee insert, with or without patella, has elasticated ligaments and PCL. Insert the distal femur into the femoral box section and use the pinch bolt anteriorly to stop any movement. Now feed the patellar ligament through the patellar eyelet and attach to the patellar spring. The patella tracks perfectly across the femoral condyles, and the patellar spring allows for subluxation, drilling and fitting of patellar implants during a workshop.